What is ketogenic therapy and how can it help psychiatric conditions? So, a ketogenic therapy or a ketogenic diet is simply eating a high fat, moderate protein, and low carb diet. And scientists believe that eating such a diet can help many psychiatric conditions. It's been used for epilepsy for hundreds of years, almost 100 years, I don't know the exact year, but it's been used for a long time. And there is emerging scientific research that shows that it can actually be used for things like bipolar, for psychiatric conditions like bipolar, schizophrenia, depression, anxiety, OCD. And basically, when you are on a ketogenic diet, then your brain starts to produce ketones for energy, and your brain uses that instead of using sugar for energy. And ketones are believed to be a more efficient fuel source, and that can make all the difference in somebody who has a psychiatric condition. This past Ramadan, like many other Ramadans, I felt left out. And that's because I found it very difficult to fast. In the past, whenever Ramadan would come around, in the first few days, I'd be so excited. I'd get on the fasting wagon and I would start. A couple days later, I would start to have hypomania, and the symptoms and the no sleep and no eating, it would start to creep up on me. Especially sleeping late or waking up early would disrupt my sleep schedule. The not eating would actually increase my energy and would make me start having delusions. And this would go on every Ramadan. Every Ramadan, I would go through this trend, this trajectory, and I didn't know what to do. So I became accustomed to not being able to fast during Ramadan. And when the time came around this year, I said to myself, something has to change. And I have to do something different that will enable me to fast next year. And I had looked into keto before, and I had tried to do it on my own, and it didn't work. I didn't have enough support. I didn't know what I was doing, and I stopped following that diet. This time around, I made my why really high. I told myself that I would do ketogenic therapy to put bipolar into remission so that next Ramadan I would be able to fast. And alhamdulillah, I am on that journey right now. I got in touch with Nicole Laurent, who runs the Brain Fog Recovery Program. I joined the program, I joined the support group, and right now I'm still going through the course. What has changed is my energy level, my creativity level, my stability, my sleep, my almost everything. I'm able to be more creative. I have a sustained energy level that doesn't have highs and lows. I'm able to be more present for my family, for myself. I'm able to show up for the people who really matter for me in my life. What hasn't changed, and I'll be really honest, is how difficult this way of life can be. Especially when going out, it becomes really challenging to stick to a keto lifestyle. And that is a struggle that I still deal with. And it's easier when I'm at home by myself. I can control my environment, then I can stick to the program. But when I go out with friends or family, it becomes more challenging. And that's where I have to be creative, and I just check the menu beforehand, or I don't go to certain restaurants because I know they won't have the foods that I need. So I just become creative. And because ketogenic therapy and eating in a certain way makes me more creative, making those choices and living such a lifestyle does become easier. What has become worse are the side effects from the medications that I am taking. Because my brain is working so well and it's using ketones as an efficient fuel source, the effects of the medications are heightened. So that means because I'm on a path to recovery and I'm doing well, I need less medication. that means that the side effects of the medications are heightened, and therefore there's potentiation effects. And inshallah, I am on a path to decrease the medications with psychiatric and professional help with my doctor. That's a very key point to make. Never stop psychiatric medications on your own. Always do it with a health professional, and make sure that when you are decreasing medications, you have a medical intervention like ketogenic therapy in place, because you need something to replace the medications. You can't just go off cold turkey and expect to be better when you haven't put anything in place to augment it or to supplement it, or just something that can take its place. How I navigate keto every day is that I meal plan a lot. I cook much of my food at home. For example, I'll make almond bread at home because you can't really find keto bread outside. If you do, it's not very keto friendly. They market it as that, but it's not really. And I really have a clean pantry and a clean fridge. And by that, I mean that there are no trigger foods, there's no trigger snacks that can really make it difficult for me to stay on track. How am I gonna navigate keto during Ramadan? We'll see when Ramadan comes around and I need to wake up for suhoor or I need to go to sleep late. Alhamdulillah, the next Ramadan, Ramadan 2027, will be closer in winter where I am, so that the days will be shorter and I won't have to wake up so early for Fajr or wait so late to eat at iftar time. So I think it'll be fine, inshallah, especially having put keto in place as a treatment plan. I think I won't go into mania during Ramadan or hypomania. Now that's just my goal. Allah knows best what is going to happen and how it will play out, how the story will play out. But I am starting out with high hope, and I know there will be bumps along the way, but that is just market correction, and I need to keep moving forward and do the best I can to fulfill this pillar in Ramadan, to fulfill this pillar in Islam. I always remember that our body, it's an amana, it's a trust from Allah. That means that when you find fasting is difficult, or when you find that the medication you're on, you become treatment resistant and you can't really get better because of the medication, it's your job to find a treatment that works, because the body you have, Allah trusted you with it. He gave it to you as a gift. He gave it to you as something that you're borrowing and something that you have to give back one day. And all that is going to count is what you did with it, your deeds, your actions, not what it looks like, not how it's shaped or how tall it is, how clear your skin is, what size it is. None of that matters. What matters is, what are you doing with it? Are you putting in things that are harming you, or are you putting in clean, healthy food that is making it easier to do ibadah? So for me, for example, it was becoming difficult to fast. And when I found a treatment that could put the bipolar I have into remission, and that would inshallah enable me to fast, then that is my steps in caring for an amana that Allah gave me. When I know I have the ability and the choice to put something in my body that is going to treat the mental illness I have, and that's going to enable me to do a pillar of Islam, then it's my duty to take that step. When, let's say, the medications are working and I don't have severe side effects and I'm not treatment resistant to medications, then that is the step and the route I need to take. I know I tried that for 20 years and it didn't work. So when I found this therapy, I realized this is a path that I can embark on. It is something that's going to make it possible for me to worship Allah better. Now, medical ketogenic therapy is not right for everyone. And I know very little about that part, I'll be honest, because it's right for me and it's working for me, but it might not work for you. And I know certain health conditions where ketogenic therapies do not mix well. It's up to you, or it's your job to do your research, look at what other pre-existing conditions you have, medical conditions, and can a ketogenic lifestyle work for you? Everybody needs to do their own research, find what your body is like, find what works for you, and go on that journey. Also, whenever you're about to make such a drastic life change, because ketogenic therapy is a very powerful intervention, and for many people, you can check out Metabolic Minds YouTube channel. For many people on that channel and in all over the world, this medical intervention has actually taken the place of medications, because it is such a strong way of changing your body's way of functioning that they're able to actually live on it without any psychiatric medications. Now, it's not always possible for everyone, and every single one of these people, they talk to their doctor first, they worked with their psychiatrist. If they started off all by themselves and they went cold turkey on their medications, they did suffer, they had withdrawal effects, they ended up in the hospital. So this is a big disclaimer that always work with your doctor, your psychiatrist, or your mental health professional. Work with them and let them know that, hey, I'm going on this ketogenic diet, I'm going to be putting this therapy in place. Can you support me? Can you keep an eye on my symptoms to make sure I'm not having withdrawal effects? And once you have the therapy in place, your ketone levels are stable, you are in a state of ketosis, then you can start thinking about tapering the medications. But only when you speak to your psychiatrist, only when you have that professional medical help. Doing it on your own is a big no. Do not try this on your own, because it can be really dangerous. You can end up in the hospital and you can become worse than what you were before. This is what I've learned so far being on the ketogenic therapy in trying to put the bipolar I have into remission. It has been a rewarding journey. I've been on it for months. I started right before Ramadan this year. It has been rewarding. I have gained a lot of energy back, creativity, stability. At the same time, it's been very difficult. There have been times where I fell off the bandwagon. At the same time, I was very quick to get back on track and just to pick myself up and make the next day better than it was before. And I always have medical professional help. I have a whole support team that is keeping me in check to make sure that I keep moving forward and I don't fall back. And I'm still learning, because this is still an emerging field. I'm still learning how to fine-tune my diet, the foods, how to find alternatives, how to make this how to make this a lifestyle rather than a fad diet for weight loss, because a lot of people do use it for that. And though that's a nice side effect, that's not the reason why people with psychiatric conditions do it. They just want to put their illness into remission, an illness that is medication resistant. They use ketogenic therapy as a treatment to put their illnesses into remission. I hope this video gave you some information about ketogenic therapy. Maybe you'll try it out for yourself. This is what I've learned so far, and this is my journey so far. I'm still new on this. At the same time, inshallah, my goal is to put bipolar into remission, and so that I can fast next Ramadan. All right, see you in my next video. Assalamu alaikum.